Good morning, students. In today's lecture, we would talk about unpaired cranial venous sinuses, that is the superior sagittal sinus, the inferior sagittal sinus, and the straight sinus. So, in this figure here, in green is the superior sagittal sinus. It is located or it is in relation with the upper convex attached margin of the falx cerebri. This is the falx cerebri, folding of the dura mater, and this is the upper convex attached margin where the superior sagittal sinus is located. So the location is, it occupies upper convex attached margin of falx cerebri. It begins anteriorly at the crista galli and ends at the internal occipital protuberance. So this is the view of the interior of the base of the skull, and in green here is the crista galli, which is part of the ethmoid bone. So anteriorly the sinus begins from this crista galli, and posteriorly this green dot is the internal occipital protuberance. So it begins from here and it ends here, and at the beginning there is union of tiny meningeal veins from where the superior sagittal sinus begins. When it ends, it turns to one side, especially the right side, and it becomes continuous with the transverse sinus of the right side. So when it runs upwards and backwards, the size progressively it increases. This you can see in this figure. As the sinus is moving up and back, the size is progressively increasing. There is a term which is known as confluence of sinuses. It is given to the point of junction of three sinuses, that is the superior sagittal, the transverse, and the straight sinus. The communication of this sinus is with the veins of the frontal sinus. As you can see, it begins from here, closer to the location of frontal sinuses. So it is related with the veins of the frontal sinus, and if the foramen cecum remains patent, it is also communicated with the veins of the nose, and if it remains in communication with the veins of the nose, then any infection in nasal cavity could reach the sinus as well. The tributaries are superior cerebral veins, the parietal emissary veins. Emissary veins, again, they connect the extracranial venous system to the intracranial venous system. So from the parietal side, from the side of the parietal bone, there are emissary veins. Then venous lacunae. Venous lacunae, these are certain lateral pouches of the superior sagittal sinus of the brain. And so first these pouches receive the diploic and meningeal veins, and then they are drained or they open into the superior sagittal sinus. And if the foramen cecum is patent, the tributaries are also received from the nose. In this figure, these are the lateral pouches, the venous lacunae, which receive the diploic and the meningeal veins first and then drain them into the superior sagittal sinus. The inferior sagittal sinus is a very small channel, and it is located in the posterior 2/3 of the lower concave free margin of the falx cerebri. So this is falx cerebri. This is the upper convex attached margin. This is the lower concave free margin. So this is a small inferior sagittal sinus which is located here, and it ends by joining the great cerebral vein or the great vein of the Galen. The straight sinus is here in the figure in green is the straight sinus. It is located at the junction of the tentorium cerebelli and the falx cerebri. These are the two dura mater foldings. This is falx and this is tentorium, and at the junction of both is the straight sinus located in the median plane. And the formation of the straight sinus is by the union of the inferior sagittal sinus and the great cerebral vein. We have already seen in this figure. This is inferior sagittal sinus, great cerebral vein, and at the union the straight sinus is formed. The straight sinus ends at the internal occipital protuberance. This you can see here. It also ends at the internal occipital protuberance where the superior sagittal sinus ends, and it becomes continuous with the transverse sinus of the left side. So superior sagittal becomes continuous with the transverse sinus of right side, and straight sinus becomes continuous with the transverse sinus of the left side. In this figure, this is a confluence, the point where these sinuses they meet. The tributaries of the straight sinus, it receives few superior cerebellar veins. As far as the clinical condition is related, there could be thrombosis of the superior sagittal sinus because of spread of infection either from nose, as if the foramen cecum remains patent, then veins of nose can spread the infection. The venous lacunae can spread the infection of the scalp or the diploe, and if there is a spread of infection from these sources, there could be a rise in the intracranial pressure, as there would be defective absorption of the CSF. There could be delirium, convulsions related due to the congestion of the superior cerebral veins, and also paraplegia due to the affection of the upper motor neuron. So that's all about the anatomy of the 3 unpaired venous sinuses. Thank you so much.